is very important and many times it is asked in examination. First we will discuss in English and later on in another lecture we will discuss the same topic in Hindi. Let us start. Counseling is a therapeutic helping process. It supports emotional and psychological well-being of a person. Counseling is a professional, confidential talking therapy, in other words, we can say, designed to help individuals navigate emotional, mental, and social challenges. If we have to write the definition of counseling, then what we will write? Counseling is a therapeutic process in which a trained professional or counselor help an individual or group explore and manage various personal issues. Now we can discuss about areas of counseling in nursing. Sometimes a small question appears for 2 or 3 marks that what are the areas of counseling in nursing. So simply we can tell that the areas of counseling in nursing include addiction, anxiety, grief and loss, depression, trauma, pre and post operative stress, eating disorders, family planning services, terminal illness, self esteem, and confidence building. So these are the basic areas where counseling is given in nursing. Now, objectives of counseling. The main objective of counseling are it encourages individual to break harmful habit and adopt healthier, more productive patterns or habits. It provides tools and strategies to manage stress, anxiety, and difficult life circumstances. It also helps in developing better communication, setting boundaries, and resolving conflicts with others. It helps in understanding of one's own emotions, thoughts, and behaviors, as well as accepting oneself. Counseling also helps the client in gaining control over their life, making informed decisions, and becoming self-sufficient. It helps in developing the ability to identify the process and express emotions in healthier manner. Dear students, it also helps in enhancing the skills to overcome specific challenges and navigate life transitions. And it helps in facilitating the realization of an individual's potential and fostering self-actualization. Now we come to another question which comes in examination related to counseling, that are principles of counseling. First principle is acceptance. Accept the client as they are, including their physical, psychological, and social condition without being judgmental. Second one is confidentiality. Protect your client's privacy and keep their information secret, which is vital for building trust between you and your client. Then empathy. Understand the client's feeling and perspectives. It's known as empathy. It means putting oneself in their shoes rather than just showing sympathy. Okay, keep in mind that you can tell, yes, I am understanding this situation whenever you are talking to the client. So your behavior or your talking system should be empathetic. Then next principle is non-judgmental attitude. Your attitude while providing counseling should be non-judgmental. Avoid criticism, biasness, negative commentary regarding a client's behavior or feeling. Just be non-judgmental. Next principle, individuality. Recognize that each client is unique and treat them according to their specific needs and circumstances. Next principle is communication. Utilize skilled, clear verbal and non-verbal communication to foster understanding. Autonomy. Respect the client's right to make their own decision and fostering self-determination. Next principle, non-emotional involvement. Maintain a professional detachment to ensure objective support, avoid getting carried away with the client emotions. Next principle in counseling is purposeful expression of feeling. Allow the client to express the emotions freely. It may take time, no problem, give time. This is essential for the counseling process. Then cultural awareness. Recognize and respect the cultural background of the client and the feelings of the client related to his or her own culture. Now we come to another question regarding counseling, that is types of counseling. There are 3 types of counseling: directive counseling, non-directive counseling and elective counseling. Now we will discuss about them one by one. First one is directive counseling. Directive counseling is also known as counselor-centered counseling. It means here in this type of counseling, counselor play active role in solving the client's problems. The counselor analyzes the problem and provide advices, suggestions to the client. Characteristic of directive counseling includes counselor takes the lead in the counseling. He or she focuses on the problem solving and provide guidance and advice. In non-directive counseling, the center or focus is on the client. In this type, the client play a major role in discussing and solving their own problems. The counselor mainly listens, understands and provide emotional support. The characteristics of non-directive counseling include client leads the conversation, counselor provides support and understanding and encourage free expression of feelings. Then finally, elective counseling. Elective counseling combines both directive and non-directive approaches. The counselor uses different techniques depending upon the situation and client's need. It is considered a flexible and practical approach in modern counseling. Now the process of counseling. How counseling starts and how it ends. The counseling process includes 5 steps. Number 1, establishing IPR with the client. Number 2, assessment of the client's problem. Number 3, setting the counseling goals or what we have to achieve, and intervention and the counseling session, main activity of the counseling, and finally evaluation and termination. First of all, we will discuss the establishing IPR with the client. The first step in any counseling is establishing IPR, the first and most important step, because through this step the trust is developed. The counselor builds trust, rapport and a comfortable environment so that the client feels safe in sharing personal issues or problems. The key element in this step are, first of all, warm greeting and friendly behavior with the client. We start with active listening, what the client wants to say, showing empathy and respect, and ensure the confidentiality with the client. For example, a college student comes to a counselor feeling stressed out related to his or her studies. The counselor welcomes the student, listens patiently, and reassure that the conversation will be confidential This makes the student feel relaxed and open to talk. Now second step starts. Assessment of the client's problem. What is the actual problem? In this stage, the counselor collects detailed information about the client or the problem to understand the basic cause or root cause of the problem and effects through various methods. The methods used in assessment includes asking open-ended questions. Always open-ended questions are asked so that the client needs to speak something. Then interviews, sometimes psychological tests are applied, and just observing the behavior of the client. For example, the students say that they are stressed. Then the counselor asks the question, okay, when did the stress starts? Now the client thinks and tells about it. Then, is it related to exam, family, or time management? After discussion, the counselor finds that the student's stress is mainly due to poor time management and fear of failing in the exam. Then setting up counseling goals. Next step is, once the problem is understood, the counselor and client set clear and achievable goals to solve the issue. These goals should be specific, realistic, and measurable and time bound. Example, for the stressed out student related to study, the goals may be: number 1, create daily study schedule, reduce anxiety related to the exam, improve concentration for the study, and these goals guide the further counseling process. Next step is actual counseling process. This stage involves applying counseling techniques to help the client overcome their problem. The technique may include cognitive behavior therapy, stress management techniques, problem solving strategies, and motivation and encouragement. For these techniques, we can definitely take the separate examinations. Example, the counselor teaches the student how to make study timetable. Relaxation techniques are taught to reduce the anxiety. Positive thinking technique like replacing the I will fail with I can improve with the practice. Through several sessions, the student begins to feel more confident and organized. Then final step is evaluation and termination of the process of counseling. In this final stage, the counselor checks whether the counseling goals are achieved and decide when to end the counseling process. Reviewing the process, discussing the improvement, and giving final advice for future strategies. For example, after a few days or few weeks, the student reports that they are following the study schedule and they are less anxious. The counselor evaluates the progress and ends the session while reminding the student that they can return anytime if they feel or they need. Thank you, students. Have a nice day.